we will get going here. So welcome everyone to our monthly low carb, high fat ketogenic diet support group / informational session. I'm going to go through just a little bit on kind of why I even talk about this stuff, and then we'll go a little bit into, I think I have about, I don't know, 8 or so studies that I thought were interesting in the last month. But so back to insulin. So we live in a glucose-centric medical world. We test glucose, and if glucose is abnormal, we test hemoglobin A1C, which is a 3-month average of glucose, but we don't test insulin. And my bias is that we should be living in an insulin-centric world, that we should be testing insulin because that will go up far sooner than glucose goes up. So this is Kraft curves, and for those people who've been around a while, you've seen these numerous times. But what these curves are showing is what happens to insulin after a glucose tolerance test. And this is in non-diabetics. So these are people who have normal fasting sugars. And curve number 1 is what we would consider to be a normal glucose or a normal insulin curve, meaning you give the glucose rises in the bloodstream, so therefore insulin is produced and dumped from the pancreas into the bloodstream to help push that sugar back into cells. And once the sugar is taken out of the circulation, insulin comes back down. But in curves 2, 3, and 4, there's a significantly abnormal response. And when it delays coming down, like for instance, in number 4, that's when we get a resultant hypoglycemia. It's why people tend to feel hungry or even hangry in between meals, like they get mean or they feel like they're going to die. So I hear those comments, and those are even in people who have normal fasting insulins on occasion. So even if you have a
Hi,
normal...
Dr. K, sorry to interrupt. Did you move on to the next slide already?
I'm on the Kraft patterns.
We only see the first slide first.
Really? Okay. Let me, thank you for, I will start over. Now do you see it?
Yeah, now I see it.
Okay, perfect. Okay, so let's go back. So Kraft patterns, insulin response. So we're looking, again, I don't want to be in a glucose-centric model. I want to be in an insulin-centric model. So when we have a glucose load, a glucose tolerance test, we end up with insulin response from the pancreas, and curve number 1 is normal. It starts low, it comes up just over maybe to around 50, and then it goes back down relatively quickly. When insulin rises higher or stays up longer, we end up with resultant hypoglycemia, or people needing to eat in between meals to kind of keep their energy up because the body thinks that the glucose is going too low, or maybe it is going too low. We have hypoglycemic episodes. So patterns 2, 3, and 4 are considered abnormal, even though they are normal glucose and may even have normal fasting insulin. You can see number 4 has an abnormal fasting insulin. If you look at the baseline, it's actually quite elevated, but all the other ones actually have relatively normal fasting insulin. So we want to know, A, what is fasting insulin for sure, but what we really want to know is what's happening after we eat. But the reason I care so much about insulin in a cancer setting is that insulin is actually a growth factor for cancers. So when we look at, for instance, the study on the left looked at staining breast cancer tissue with for insulin receptors. So instead of looking for estrogen or progesterone receptors, looking for insulin receptors, and the center plot graph is on breast cancer tissue. So far more insulin receptors on breast cancer than on normal breast tissue or even on fibroadenomatous breast tissue. And if we look at the next little cartoon here, is that when insulin is in the circulation, insulin binds the insulin receptor and then allows glucose to come into the cell. And how do we know that that works in cancer? Well, we do PET scans. We inject patients with glucose. Glucose rises insulin, and then insulin binds to highly metabolic tissues such as cancer and pulls glucose into the cell. So here on a CT scan, it may look very normal, but when we use a PET scan or radioactive glucose, we can see that a cancer will significantly uptake that material. And if we look a little bit further, there's more than just insulin. There's also what we call insulin-like growth factors 1 and 2. And all of these are receptors on cell surfaces. And when they get activated, they then kind of trip certain pathways. This happened to be in a breast cancer journal looking at insulin-like growth factor 1 and 2, and all the different pathways that they stimulate. But these are growth pathways. They're pathways for metabolism, for migration, for proliferation, and they block apoptosis. Apoptosis would be natural cell death. And this was an article that was just published this last month, kind of going through what is the data on low carbohydrate diets in cancer. And the conclusion was just that low carbohydrate diets have a promising mechanistic rationale for the treatment of cancers with favorable preclinical data. And the strongest data does suggest that there's synergistic effects, meaning that dietary interventions, when you combine them with traditional cancer therapies, you tend to get the most robust results. So that has been shown, and I feel like I've shared a lot of those data with you. But they're all small trials or they are preclinical, meaning that they're in animals. But their safety, their feasibility, ideally, we start doing this in a lot more patients, or at least offering it, because there's a big upside and not a very big downside. And I would say no downside, to be honest, but that's, I guess, neither here nor there. So this was an interesting, these are different diabetics who wore continuous glucose monitors. And I think some of you probably have seen them in the past, but they're kind of little stickers that go on your arm or other places of your body, but they have a little sensor that is in your serum or in the fluid, and it can track your glucose. And so this was a diabetic. The first 2 graphs were in a type 2 diabetic, following what would be considered kind of a healthy high carb diet. So lots of vegetables, nuts, seeds, fruits, whole grains, etc. So not junky processed carbohydrates. And you can see that her sugars really went up and then had a number of lows. So ups and downs and ups and downs. So hyper and hypoglycemic. But if you look at her average glucose, it was 121. So a little higher than I'd like to see, but still, when she then went on to a healthy lower carb, she called it a low carb. I put in the lower because I don't think 146 grams of carbohydrate is a low carbohydrate diet, but it certainly is lower than 313 grams. And you can see that the sugars were much better controlled, not the big roller coaster. So zero hypoglycemic episodes, really not too many super high, but she put her error bars a lot bigger than I would. So she put the red bar at the bottom, which was 70, and the high bar at the orangish or peach color at 150. And I'd love to see a tighter range than that. So this last one is actually a type 1 diabetic who controls insulin use by following a very low carbohydrate diet of approximately 30 grams of carbohydrate per day. And these ranges are set at 70 and 115, so a much tighter range. And you can see that those blood glucose graphs or curves are much tighter. So the tighter you make your carbohydrate intake, the tighter your sugars are. Now, granted, if you don't have diabetes of any type, you may have a better sugar curve anyway, but I would say that a lot of people are quite surprised. So even people who don't, that I put continuous glucose monitors on, or we have them stick their fingers with glucometers, actually have significant jumps at certain times of the day. Maybe it's first thing in the morning with that dawn phenomenon, and then we have to kind of look at timing of meals and macronutrients of meals, especially at bedtime. But there's significant information that you can find by testing your own glucose with a finger prick glucometer. But how do we do this really? Well, we just start eating real whole and low carbohydrate foods. So that's animal proteins, eggs, fish, beef, pork, chicken, lamb. If you want to throw in some organ meats, liver, it would be outstanding. Natural fats, so the fats that come in your proteins, like the fatty fish, whole eggs, no egg whites, but adding in olive oil, avocado, coconut oil, butter, maybe some dairy fats if tolerated. Not everybody tolerates those. Most people will tolerate butter and ghee. And then it's kind of an N of 1, meaning you need to test it for yourself. And then the leafy greens and the non-starchy vegetables, basically the above ground vegetables, are the ones that are going to have the least glycemic response. Nuts and seeds, some people can do in a small quantity. Large quantities will increase your carbohydrate as well as your omega-6, which we'll touch on. Berries, same thing. Even though berries are the lowest glycemic fruit, they still have sugar in them, as you can taste. So we want to keep those to a minimum. And we definitely want to avoid sugars. And if you read a label, sugar is named many, many different things. There are lots of oses and glazes and syrups. And so just kind of think about it when you're at restaurants and how they describe things. So glazes is often used in restaurants, but syrups and all the probably 50 names of sugar can be on packages. Processed foods, really, if it comes in a box, a bag, or a wrapper, it's probably best to avoid. My caveats on that is every once in a while there is a nicely made product like the egg thins, like the Egg Life tortillas. I will say, you know, obviously some nuts and seeds come in boxes or bags. But for the most part, even the processed meats, they look like they're just meat, but if you read the label, they have numerous additives and things in there that probably we shouldn't be eating. Processed fats are a big no-no. They are very high in omega-6 fats. The omega-6s can push your omega-3s out of the cell wall and set you up for insulin resistance, even if you weren't eating a lot of carbohydrates. These are in almost every processed food. So reading labels, again, they're also in a lot of supplements. So vitamin D is a big, any of the fat soluble vitamins are sometimes in these oils. So you got to even read labels on those. And then trying to get away from the starches, the grains, the bread, pasta, rice, all the whites, as well as legumes. Beans tend to be very high in starch. Most fruits, on occasion, you know, a bite here or there, or if there was some salad that had a couple of pieces of fruit, it might be okay, but really think about that. And then artificial sweeteners can be used, although I will say they get a lot of people into trouble. So it keeps that sweet addiction alive. It can cause problems with gut health in some people. I know that I have an issue, especially with stevia. It's very inflammatory to me, so you may want to test them. You may want to check blood glucose changes. If you can avoid them altogether or limit them significantly, that's really the best. And then looking at it, so I usually say, you know, fats that come in bottles, again, olive oil, avocado oil, you really need to test your quality. There are a lot of people that are cutting those things with soybean oil or canola oil, and so they're not truly pure. You may want to just ensure by looking up reviews, etc. And then again, anything in a box or a bag, usually, you know, not suitable for health. This was an interesting study looking at this omega-6 to omega-3 fatty acid ratio and how just that change in ratio or the increase in omega-6 fats increase the risk for obesity. And is it, if somebody, you know, are those omega-6s really coming in the processed foods, or is it just because someone's using a soybean oil dressing? I think that it's probably very prevalent in most of the standard food products. And so I think that's probably mostly where it comes from. But I will say that I have seen people that have medical issues and all of their glucose and insulin numbers look really great. And the only thing that's majorly off is the omega-6, omega-3 ratio. So something to consider. So experimental studies suggesting that omega-6 and omega-3 fatty acids do elicit divergent effects on body fat gain, and it's through mechanisms of adipogenesis, that's fat, making of fat, browning of adipose tissue. So when we brown adipose tissue, our fat cells actually burn more fat, lipid homeostasis, so some kind of a natural balance, and the brain-gut adipose tissue axis. But most importantly, this is kind of what we see, systemic inflammation. So when we have a mismatch of omega-3, omega-6, our body is in an inflammatory state and therefore much more at risk for disease and other symptoms. And this was a super interesting study. So getting back to kind of our processed food environment, is they looked at the association not only of quantity of carbohydrate sources, but also quality. So how much processed food, what it was the glycemic load. So glycemic index is, you know, how much does it raise your blood glucose in comparison to sugar? And then glycemic load is how much of that food with that glycemic index. And basically each 20 unit increment in glycemic load, so the higher that glycemic index was associated with increases in hunger, increases in desires to eat something sweet, and increase in weight. So all of the things that we're trying to avoid, right? If we eat better quality food, if we eat less processed food, we are going to have better satiety. We're going to have less desire to snack and to eat those sweet treats, and hopefully with less weight gain, or maybe even weight loss, right? So these are examples of highly processed carbohydrates, and they come in many forms. So things that people think are healthy, like cereals and oatmeals, but also obviously the foods that we think are not very healthy. So quality carbohydrates are low glycemic fruits and vegetables. I usually say that, you know, if God made it, that's really where you want to be. So if we look at 20 grams of carbohydrate from real food, fruits, vegetables, nuts, and seeds, you can see that you can get big plates of food. Whereas if you are doing processed carbohydrate or starchy carbohydrates, you get very little for the same amount of carbohydrate. And we often will hear things of high fat diets are bad. I will say that most of the time when they're talking about a bad high fat diet, it's truly a combination of fat and carbohydrate, meaning a high carbohydrate, high fat diet, which is absolutely the worst diet. But many times it's actually high processed fat diet or bad fat. So it's the polyunsaturated fake fats like soybean oil. And this is a super interesting picture that was in somebody's YouTube, that natural butter down in the corner has all these little black ants on it. So the ants all ran to the butter and pretty much left the margarines alone. So, you know, our natural state is to go to the real foods. And unfortunately, we as humans don't taste the rancidity, the oxidations of these highly processed fats. And so we don't notice the difference as much as animals do. So that was pretty interesting, or insects, I should say, for this one. So when you choose real food made by nature that are in season in your area, you are typically and naturally eating minimally processed, low carbohydrate and low omega-6 fat foods that are nutrient dense and aid in satiety. So if you just stick with Mother Nature, you're going to do pretty well. Many foods that require processing, even minimally processed foods like minimally processed grains or legumes, because you can't eat a raw bean, but you have to process it to some form so that it's actually not poisonous. You know, so if you can go out in your backyard and you can pick it and kill it and eat it, then you're going to do much better than if it has to go to a factory for any processing. Another interesting study on high omega-6 fat diets, looking at gut microbiome. So in this study, a high fat diet, in this one, they used soybean oil, and this was in mice. They fed them this from weaning all the way into adulthood and found that it shifted the gut bacterial profile and made it very consistent with colonic inflammation. So their colon was very inflamed compared to not putting them on a soybean oil diet. And it also increased, obviously, the plasma levels of the omega-6 fatty acids. It created the colonic, or it had expression of COX-2. So I don't know if anybody remembers these COX-2 inhibitors that we used to put people on for joint inflammation and such, and then there were some other side effects, but COX-2 is a very potent inflammatory, or a notable inflammatory agent. And then the number of colonic inflammatory and hyperplastic lesions seen in the colon went up. So you can just imagine getting all of these colonic changes, and here we like to blame meat, but it's probably soybean oils and these processed omega-6 fats. This was the difference looking at body weight. So in this group, interestingly enough, the omega-6 high-fat diet, I guess not unsurprisingly, was much higher than the regular wild-type diet, or the Western diet. And then to get into a little fasting. So a fasting mimicking diet was used to investigate, so we've talked a little bit about 5-day fasting mimicking diet. So again, that can be true fast, that can be very low calorie days, that can be, so it can be done with calorie restriction, it can be done with ketogenic diets. This one was a severe calorie restricted. I think it was still a low glycemic diet. This was a Walter Longo type fasting mimicking diet. And what they did is they put a patient on this fasting mimicking diet 5 days every 3 to 4 weeks, while the patient was undergoing standard conventional therapy for their cancer. So this was 101 patients. And they found that this repetitive fasting mimicking diet really reshaped the anti-cancer immunity, the immune signatures that were associated with better clinical outcomes. So again, early data, but suggesting pretty impressive stuff. So, and I don't know if it has to be 5 days and then you eat normally for, the next 3 weeks. Could just adding fasting a few days a week, every week, could it, I don't think we know what the proper, fasting to eating to feasting, but I think that fasting and or fasting mimicking diets, which is why I'm a huge fan of a ketogenic diet, really probably impacts patients' outcomes. Another one on the gut with intermittent fasting. So the group of mice, so this is a special type of, or rat, excuse me, that they will develop high blood pressure. And one of the groups had unlimited access to food, while the other group was only fed every other day. So again, intermittent or alternate day fasting. And at 9 weeks, in the rats that were given unlimited access to food, they had all developed high blood pressure as expected. But those that were fed every other day did not develop high blood pressure. Then they took germ-free rats, and then they gave them the microbiota. So I'm assuming like a fecal transplant or something from these fasted mice or rats. And then they had lower blood pressure than if they got the same microbiota transfer from the normal fed mice or rats. So super interesting. So the intermittent fasting or alternate day fasting prevented high blood pressure. And then if you took these germ-free rats and you transferred, so colonic or gut microbiota transfer to these germ-free mice. If you gave them the fasted one, they didn't have high blood pressure, but if you gave them the regular fed microbiota, then they developed high blood pressure. So pretty cool microbiome stuff with, so intermittent fasting probably has some benefit on gut health in multiple ways. And a couple of notes on red meat, because I always feel like I have to fight for red meat because it always gets such a bad rap. So it's always about asking ourselves better questions. But this was a study that looked at the Danish National Survey on Diet and Physical Activity. They looked at intakes of red meat, processed meat, poultry, and the risk of colorectal cancer. They also looked at all-cause mortality. And what they found was there was no significant association between red and processed meat intake and colorectal cancer risk. For poultry, they thought there was, or they saw an increased colorectal risk for high versus low intake, but not when examining the risk in a 100-gram increased intake. So my thing is that it probably is not related, because in theory, it should be a continuous kind of, the more you eat, the worse things are if it's truly related. But I always pick red meat over chicken. And then they showed no association between meat intake or all-cause mortality. And the association between meat intake and colorectal cancer or mortality risk was not modified by the dietary quality. So just another kind of observational-ish study. So we can't take a ton with that. I like the interventional studies better, but I think that this was a very large study. So it was nice to see that yet again. I think last year, maybe we saw another, maybe it was 2 years, maybe it was 2019. We saw another big meta-analysis showing that red meat does not actually cause cancer or colon cancer, which is really the only one that is listed currently, even though they like to talk about it in a group. And then this was another one out of Italy. So this one was interesting because there was a recent, well, I think it was 2016 maybe, that an American study showed that animal protein had higher risks of all-cause mortality. This one shows the exact opposite, and it may be the country and what's associated with meat intake. So in Italy, they probably don't have quite as bad of a, standard American diet. So we have so much in the way of processed foods that most people eating animal protein are eating a lot of processed carbohydrates along with that, right? The buns, the breads, the pizza crusts, etc. Most people are not just eating steak and vegetables. In Italy, they looked at animal protein intake in 1,000 plus older adults. The mean age was 75, and they followed them for 20 years. They did it by food frequency questionnaires, which is how almost all of these are done. So they're not the best quality, but they're all done this way, so they're reasonably comparable. They did do 5 clinical follow-ups so that they could chart their health and other markers of health. What they counted protein as a % of total energy intake. And then what they found is that the more the animal protein intake, the lower the all-cause mortality and the lower the cardiovascular mortality. They looked at how much in the way of plant protein intake, and they found that there was no association with any of the mortality outcomes, but there was an interaction with hypertension at baseline, and that was associated with all-cause and cardiovascular mortality. So bottom line is animal protein is actually good for your health, in my opinion, and based on these studies that were just published. And I always like to throw in a COVID thing because I think they're interesting. So this was an interesting study where they found that the SARS-CoV-2 actually infected the macrophages and the adipocytes, or the fat cells, in multiple areas of adipose deposits. So that would be like, yes, the subcutaneous fat, but also in the visceral fat and the fat in the liver and the fat around the pancreas, etc. And they found that that these findings supported the adipose tissue infection and pathogenic inflammation, and may explain why there's such a strong link between obesity and severe COVID-19. So even more reason to get rid of fat cells using low carbohydrate eating and fasting. So I will always say, please eat naturally, avoid man-made foods as much as you possibly can, and limit man-altered foods. So even the minimally processed or the, I kind of say like all of our fruits have been bred to be sweeter, but really less nutrient dense. So the more we can go back to nature, the least modified of any foods and the best naturally raised foods, we're going to be far better off. We're going to be far more satiated. We're going to be able to fast easier. And we're just going to be healthy overall. So say no to drugs and say yes to real food. And I think that's, and if anybody follows, there is a guy out there that does this unlearn, rethink, and he always has very nice sayings. I think they're really kind of on point about getting back to eating naturally. And then I'll just throw out that I'm so close to being ready with all my information that hopefully next meeting I'll have all of my new contact information. So stay tuned. And next month's meeting will be January 19th, and I will stop sharing.